Hi, my name is Wendy. I am a colon cancer survivor.
Hi, I'm Carol. I'm from New Jersey and I am proud to be a colon cancer survivor.
Hi, I'm Fred Markman and I'm a cancer survivor.
My name is Beth Spinelli. I'm 75 years old and a cancer survivor.
I kind of felt small little symptoms of stuff that I didn't think was anything other than like irritated intestines. I had seen 2 other doctors who basically told me they didn't think that anything was wrong. They didn't do any kind of tests or anything. They just said they didn't think anything was wrong. I finally came to see Dr. Sinha. She had recommended several tests, one of them being a colonoscopy. And at that point is when she found the cancer.
I went in for a regular physical. I had, blood in my stool. I was hoping for maybe hemorrhoids or something like that. Contacted Dr. Sinha and we scheduled a colonoscopy and found out that there was a tumor.
I was hemorrhaging, and so I had to go to ER, and that started the process of trying to figure out what was wrong.
I had symptoms, and at my age, I was in my early 40s at the time, they were easily dismissed as nothing to worry about. And obviously there was something to worry about.
I was pretty much on the floor, crying my eyes out here. I got a phone call from Dr. Sinha's office. They brought me in the office and Dr. Sinha said, I have good news and bad news. The good news is you're not very far along in the stage. You're not even stage 1, but you do have cancer.
Initially, I thought I was going to die. I didn't understand what was involved, and just when she said you have colon cancer, my mother died of colon cancer, and so I just assumed that I was going to die too. But then she explained the process, and then I thought there was some hope that I would survive it.
Well, first there was disbelief. I think I was in shock. Second came the fear of the unknown and what happens next.
I guess, I wasn't surprised. I think I was focused on trying to find a remedy at that point. I wasn't thinking the worst. I was like, okay, can we fix this?
Well, my biggest fear was that I might leave my kids without a mom.
I think a lot which goes through everybody's mind was the first thing I thought was, if I need chemo or radiation, oh my gosh, am I going to lose my hair? And oh my gosh, am I going to beat this?
Basically, that I would die and leave my family without me.
So my biggest fears were knowing that other people that had cancer might have not survived it.
My husband, of course, I have a million kids, so they helped me get through those days. Dr. Sinha assured me, she just was behind me 100%. She talked me through that you're a very small stage. It's definitely beatable, it's definitely treatable, so just trust me.
Lots of prayer, lots of friends, healthcare practitioners that were supportive as well, that said, we're gonna help you through this. You don't need to know what to do, we've got this. Those were comforting in those early days.
So that went pretty quick. It went from the port to right away into chemo and radiation within the next month.
I had the tumor removed and did some chemotherapy afterwards. And after 12 cancer treatments, I was cancer free.
They did radiation first. Radiation burns your skin, and I understand it, they don't have this type now, but this was 20 years ago. So that took a lot to get through. And then the chemo, that's what was simple. And then they started with the scans, all kinds of scans. Those 3 things were about the most used for therapy.
Well, I didn't start out at 100 in digestive health. Before getting here, I felt like I was a number. But after being introduced to Dr. Sinha and the team here, I felt like she really cared, that she was an excellent physician. So that gave me comfort. Has meant a lot to me in the last 15 years that I've been with her.
It was amazing. The staff would try to answer the questions the best that they could, and I was the type of person that was like, okay, but I really want to hear that from Dr. Sinha, and lo and behold, she would call me back within the hour to say, okay, this is what's going on. This is what's going to be next. This is the treatment. This is how you're going to feel. What's going on with you is perfect, is fine. It's not out of the ordinary. I needed a lot of support to assure me that things that I was feeling was what I should be feeling and that I wasn't dying.
I mean, Dr. Sinha is a great doctor. When I first met her, I knew that she was going to do it. I think when I came out of the operation, she already told me that she tattooed an area in my colon that looked suspicious. So I already kind of knew at that time, but she was very proactive.
So I called my primary care doctor. She said, okay, look, across the street is a private doctor's office. Her name is Dr. Sinha. So she brings me in a room and she's touching my stomach and all this stuff, and she goes, you have a tumor. It means we have to do a colonoscopy tomorrow. That she found the cancer and sent me over to the hospital to see the oncologist and the radiologist. She actually stood by me the whole time. She was kind of like always fighting for me. I felt confident that they were really going to help me.
When I first came here, after seeing the 2 other GI doctors who literally dismissed me, I came in and right away came at her and said, if you're going to dismiss what I say is going on, then just tell me now because I'll get up and walk out. Dr. Sinha, she was so confident of, I'd never do that to you. When I thought oh my gosh, I finally have somebody that's going to listen.
I think in general, everybody was supportive. I mean, they understood what you were going through. When I first started on the journey, I really didn't know anybody in my family or none of my friends that had colon cancer. So it was like I didn't have too much support on the outside. I really want a specialist that deals with this on a regular basis.
The first confidence came from hearing others, some healthcare professionals as well, saying that Dr. Sinha was the best. And then just meeting her and feeling like I was important to her and the team.
One, I understand. I think that people are not only afraid because they're not really sure what's going to happen. I also think that maybe they're embarrassed. I also think that maybe they're afraid of what the results could be.
So I would say to them, do what you have to do. Drop your fears. You can survive this. I'm a spitting image survivor, and 12 years out, get your checkup. Seek your doctor's advice on how to proceed.
Actually, the screening is very easy. It's something you should do for yourself. I think people are afraid of the prep, but it's over the last 20 years, it's gotten considerably better.
I would say, please get screened. You may have fear of the unknown, but probabilities are that you're going to get screened and find out nothing's wrong, and that's going to give you peace of mind. On the off chance that you get screened and find out something is wrong, you want to know it sooner rather than later so you can get it addressed and live a long and happy life.
Early detection, it would be a lot better to find something out early than to find something out too late. So to detect it, even if you have something, is early. Don't wait until it's too late.
It's very important. It's not as difficult to get rid of something that's very early. It's like anything else that comes with your health. If you see something wrong or you feel something wrong, take care of it right away because it's only going to get worse. It's not going to mysteriously go away. And if it does go away, no problem. At least you checked it out.
If you wait, right, you're just increasing your risk. Early detection is so important to ensure that you reduce your risk of anything bad happening.
And all I can say to anybody is, even though the treatment seems like it's going to be forever, it's actually in a blink of an eye. Just go through it. Depend on your healthcare provider, your family to support you. It's definitely doable. It's not comfortable. It's not easy. It makes you sick. It makes you hurt, but it's definitely doable.
I'd say keep positive, keep busy, don't dwell on it. Why me? Well, why not you? I mean, everybody has something in their background or life that they have to obstacles, so just think of it as an obstacle that you're going to get through.
Everything it's hard to believe, but everything's going to be all right. Just follow exactly what the doctors tell you to do. And it's a process.
If you're just diagnosed I would say take a deep breath, rely on your network, look for people who will help you get through it. That's what I would say, because one day you will be through it. You'll be on the other end.
My name is Dr. Anupa Sinha. I'm board certified gastroenterologist, founder and president of 100 Digestive Health Specialist. Hearing these powerful stories from our colon cancer survivors reminds us why screening matters so much. Colon cancer is one of the few cancers we can actually prevent through early detection. When found early, it is highly treatable and in many cases curable. As a physician, it is an honor to walk alongside patients from diagnosis to survivorship. Their courage inspires us every day. If you are 45 or older or younger with a family history or symptoms, please don't wait. Talk to your doctor about getting screened. A simple screening can save your life. Prevention is powerful. Early detection saves lives. Let's take that step together.